Hi friends, welcome back. I'm Elaine and I'm living with autoimmune disease, and today I want to talk about low dose naltrexone, otherwise known as LDN. And mainly I want to talk about my experience with the medication. LDN seems to be picking up speed in the autoimmune disease circle, especially patient groups, and I'm seeing a lot more questions in our online support groups about LDN and people's experience using the medication. I had actually never heard of this medication before a year ago, and I had never thought to ask for it, thought to use it. It had never been suggested to me. And when it was prescribed to me, I searched YouTube, I searched our patient online support groups to see what other people's experiences were with the medication. And I found kind of little to nothing. I found a lot of great experiences on YouTube, listening to people tell their stories about why they were using it and the life it gave them back, the pain management they felt. But I never found people really talking about the side effects of the medication, which is what I was interested in. So today I want to share my experience with LDN and why it didn't work for me. Spoiler alert. It was the side effects. So let's backtrack a little bit. LDN seems to be used for pain management in the autoimmune disease circle. It seems that more rheumatologists and pain management doctors are prescribing LDN to tackle the pain that is associated with chronic conditions, autoimmune disease, chronic pain. I actually have read papers that were published about the use of LDN for fibromyalgia patients. And I would highly suggest, if you ever want to know about your medication or know exactly what kind of research has been done on it, and you want to read the actual in-depth papers about it, Google Scholar your search and it will bring up what papers are written on it. And that's exactly what I did. I went into Google Scholar, typed in low dose naltrexone, and read what came up there about it. So my rheumatologist did not prescribe LDN to me. It wasn't my rheumatology issues that brought me to LDN at all. In fact, it was a cardiologist that prescribed LDN to me. And it was prescribed to me for dysautonomia or autonomic dysfunction. It was prescribed by the cardiologist to help me with the symptoms of dysautonomia during the summer. I was having a lot of problems with my dysautonomia as the temperatures rose and I was trying to function out in the world. I was having a lot more problems. So the cardiologist's suggestion was to try LDN. She explained to me a little bit about the medication, how it's used in the rheumatology circle, especially for autoimmune diseases, and thought it would be a promising drug for me to try. She did explain that we needed to start at a low dose and bump it up. And most patients end up at a higher dose than what they start. But for your body to get adjusted to the medication, we needed to start at the lowest dose possible. For me, that starting dose was 1 milligram. I'll tell you a little bit about LDN because I did not understand that my insurance company was not going to cover the medication. Because we need low dose naltrexone at a low milligram, given the low portion of it, we have to go to a compounding pharmacy to compound the drug down to that 1 milligram capsule. Going to the compound pharmacy meant that my insurance company, who normally pays for my medications, was not going to pay for this drug. It sounded promising. I read a little bit about it online. It actually looked very promising for my autoimmune disease. So I thought, why not try it? It's worth the medication price to at least give it a good try. I went to the compounding pharmacy, picked up my medication. It was $129 for 3 months. But like any autoimmune disease patient who's in dire straits, I'm gonna try to pay whatever I can to feel better. So it was worth the $129 to me. It was compounded into little capsules, as you can see. Not too big, probably the size of like an antibiotic. The pharmacist at the compounding pharmacy asked me if I had any questions. My main question was that I do use tramadol for pain once in a while, and I know that you cannot use pain medication when you're taking this medication. I did ask the cardiologist when she prescribed it. She said it shouldn't be a problem. The pharmacist did confirm that that should not be a problem. As far as I understood, it didn't have any other interactions with any other medications I was on. I was told to take it at night as it does make you a little bit sleepy. However, my cardiologist told me to take it in the morning because we needed it to control the symptoms of the dysautonomia. Now, like I said, I was super excited to start the medication. I did see some testimonials on YouTube of people saying that it really helped with their autoimmune disease. I couldn't find much about dysautonomia and the effects it had on that, but it did look promising for everything else I was experiencing. I like to start new medications with a placebo effect, honestly. It's something I psych myself up in my brain and tell myself that this could be the drug that actually makes me feel better and makes me able to function. So I started it with that mindset, very excited to see what it could do for me and my journey. So I took the medication. I was doing okay for about 30 minutes, and at about 40 minutes, my stomach started hurting. And in about an hour, I had the worst stomach pains ever. And I'm not talking about, I'm lactose intolerant, and it wasn't just like I had drank milk, and it was not like the side effects of Cellcept when I started it. This was horrendous pain, like really bad gastrointestinal, lower discomfort, just abdominal pain. And it wasn't long after the pain that diarrhea set in. And that diarrhea did not alleviate the pain I was feeling with my abdominal cavity. I called the pharmacy to check a filler in the medication because I'm severely lactose intolerant. Sometimes if milk products or something lactose is used as a filler in medication, it can affect me, and that has happened in the past. And I thought to myself, I wonder if there's some kind of a milk filler in this medication that the compounding pharmacy used. I didn't advise them that I was lactose intolerant. I called the pharmacy, and the pharmacist said, no, there was no kind of allergy fillers. They don't do that there because it's compounded. They stay away from dairy and stay away from gluten as fillers. So that was not the problem. I explained to the pharmacist what was going on, the extreme abdominal pain, the diarrhea, and she explained to me that that was a possible side effect of the medication. And she advised me that people who have gastrointestinal problems suffer from that side effect more commonly. I have malabsorption. If you don't know my malabsorption story, I'll link that down below if you're interested. But I have bile salt malabsorption, and so I often have GI problems already. When a side effect of a medication is gastrointestinal, you can best believe that my body is going to feel that. The stomach pain got worse. Now, I'm telling you, I only started at 1 milligram. It was very, very low. And I was supposed to be okay with 1 milligram. We were supposed to increase it. I couldn't do it. I couldn't get past the side effect of the GI, abdominal pain, diarrhea, and trying to function in my daily life. Now, I take Cellcept. I endured the 3 months of Cellcept and trying to get it worked out in my body. I was able to manage those side effects. This I couldn't manage. This pain was not fun. It wasn't for me. And I'm sad because it seemed very promising. I cannot find anybody's experience that was like mine on naltrexone. I feel like I can't be the only patient out there who has experienced this and couldn't muscle through it. I couldn't make it through it. Now, please remember, this is just my experience. I always want to be real with you guys about my experience with medications. And sometimes medications work for me that don't work for other people. This medication works for other people. It doesn't work for me. I couldn't stick out the side effects. I couldn't stay on it long enough to even see if the side effects were going to work themselves out. I couldn't do it. I have to function, and I can't function with abdominal pain and diarrhea. couldn't do it. So here I am sitting with 2.5, more than that, months of medication that I cannot take, that I paid for. So if you learn anything from me, if you're starting this medication, which I hope it works for you, and I hope you get the miracle stories that I heard about on YouTube, and but I would caution you to say, don't let the pharmacy talk you into getting a 3-month supply of it at the get-go. If your compounding pharmacy will fill this for 1 month, I would do a 1-month supply of this first, just to see how your body adjusts to it. You can always get the 3-month supply later. But yeah, learn from me and get a 1-month supply before you jump into the 3-month supply of the medication. So like I said, I did try this for dysautonomia, and my experience was that I couldn't endure the side effects. But I do see that a lot of people do get relief on this medication, and I hope if you're watching this and you're about to start it, that it works well for you. If you're watching this and you're trying to figure out, like, I have this GI side effect that I can't see anybody talking about, I'm that person. It happened to me. So you're not alone. I don't know if I can tell you it gets better, because I couldn't muscle through it. That was my experience on LDN that I wanted to share with you all. If you have any questions, leave me a comment down below. If you just want to say hi, leave me a comment down below. I will answer questions to the best of my abilities. Thank you for watching my experience on LDN. Hopefully this was helpful to you if you're starting, if you have a family member that's starting. If you like this video, please give it a thumbs up. It gives me an idea that you like these kinds of videos, and I can share more of my experiences on other medications. If there's any particular medication that you're wondering about that you would like me to film something on, if I have actually had an experience with it, I will do that. So leave it down below if there's anything in particularly, is that a word? If there's anything in particular that you would like me to talk about, leave it down below. I read those comments, and this is our community here, and I would love to film things that we all want to talk about. If you haven't yet subscribed and you would like to come along on my adventure, I would love to have you. The more friends, the more better. My adventure is sometimes fun, it is sometimes medical, but it's always an adventure. So hit the subscribe button. It's absolutely free. And until my next adventure, go have yours.